why social care matters, why it's not just an add-on, but a strategic investment in health and well-being.
When technology, policy, and grassroots efforts converge, it can transform how we care for people.
I'm so glad to join all of you gathered for Blooming Day 2025. I want to thank Blooming Health for organizing this important conference that brings together partners from across sectors to build a healthier and more equitable future.
We're here to discuss an ambitious goal, which is creating a robust, integrated system of care that does not just address medical needs, but the underlying social factors that impact health.
And if we are going to make the country healthier, we have to attack those inequities.
It's such an opportunity for so many people to gather together and learn new things about how to change the lives of people that might be dealing with a serious life-altering illness.
I want to mention that this is day one at Blooming Health. We're just getting started. We have pretty bold visions.
What is really unique about the Blooming Health platform is it reaches people who may not have internet connection, may not be used to using certain equipment, PCs, iPads, etc.
How do we ensure that the CBOs or the community organizations are not just referral endpoints? They're actual part of the team, the care team.
Medicine is medicine. It's on formularies coming from the drug companies, the manufacturers, and the PBMs, right? But food we see is just as powerful in moving the needle on some of these conditions. Why wouldn't we pay for it in the same way as a generic drug?
Medicaid has really changed since the Affordable Care Act. It is so important, not only low-income people who are absolutely deserving of care, but also it is crucial to the health and safety for the middle class.
And what I'm trying to do is maybe give you an idea of how all this will work together to deal with people's social determinants of health, things that give some people advantages in life, some things that give people disadvantages in life. And if we can address people's individual social determinants of health and quite frankly make life more navigable, maybe things will turn out better. I think they will.
I want you to leave feeling optimistic and empowered, even in the current environment. There is an opportunity to tell your story, communicate the impact that you're driving, and I think it really derives from a local ground-up approach.
Blooming Health, we see a 300% increase in engagement, 500% increase in SNAP applications, 10% reduction in loneliness, 7% increase in overall health and wellness. And one of the most important thing is 2 hours a day savings of our case managers' time.
AI represents an extraordinary opportunity. I think the key for using AI and virtual reality and really any technology to make sure that the end users are involved in every stage of the design process.
The flip side of that is for AI to be able to serve a diverse population, it also needs access to cultures and languages.
Having a larger and robust social network is an independent predictor of longer survival.
I believe our generation is positioned to actually address the social need gaps in our communities, to reduce poverty, to make social care a more integral part of healthcare, because it should be.
Investing in social care means you're investing in seeing people, really seeing people. And when we see each other is when we really experience our humanity.